All right. Future plastic surgeons. I know you guys are probably like drowning in textbooks right now, gearing up for that FRCS class.
Yeah.
We are here to help cut through all that dense surgical text and pull out the absolute must-knows for your exam.
That's right.
And today we're diving into hair transplantation.
All right.
So to start this whole thing off, let's get a handle on the anatomy of the hair follicle.
Okay.
Now, this textbook highlights that the average scalp has between 100,000 and 150,000 hairs.
Wow.
That's a lot of hairs.
That is a lot.
And get this, blondes have more hairs than redheads.
Yeah, that's right.
It's true.
It's true.
Wild.
So even on a bald scalp, you've still got those follicles.
Really?
You have the same number. It's the type of hair that changes, not the number of follicles.
Okay.
So remember, the follicular unit is the key surgical unit in hair transplantation.
Okay.
And that includes the terminal hairs, the vellus hairs, sebaceous glands, and even a tiny muscle called the erector pili.
Oh, wow.
It's a pretty complex little structure.
Yeah, I never really thought about it like that before.
Right.
Like, I always thought it was just the hair itself, but it's like this whole unit.
It's a whole unit, the follicular unit.
Okay, cool.
Now let's talk about the hair growth cycle.
Okay.
It's super important to understand the different phases.
All right.
You've got the anagen, the catagen, and the telogen.
Cool. I've heard those terms before, but I don't really understand them.
Think of it like a plant.
Okay.
Sprouts and grows, that's your anagen phase.
Mm-hmm.
Matures, that's catagen.
Gotcha.
And then eventually sheds, and that's telogen.
Okay. That analogy makes it much easier to visualize.
Right.
So balding, is it just a matter of hair loss, or is it more about this cycle getting messed up?
You're exactly right. Balding is all about the ratio of these phases.
Okay.
In androgenetic alopecia, an anagen phase gets shorter, while the telogen phase it gets longer,
Okay.
leading to more hairs being in that resting or shedding phase.
Ah, I see.
This is like super important to understand for the exam, as it ties directly into how those treatments like minoxidil and finasteride work.
Gotcha.
They're actually trying to shift that balance back in favor of the anagen or growth phase.
That makes perfect sense.
Good.
Now, the source material also delves into alopecia, and the numbers are pretty staggering.
Yeah.
35 million men and 21 million women in the U.S. alone are affected by this.
Yeah, it's a really common condition.
Oh.
And it's important to understand that male pattern baldness, which is, the most common type, it's not normal aging.
Okay.
It's driven by hormones, where those thick, pigmented terminal hairs are converted into finer, shorter vellus hairs due to DHT dihydrotestosterone.
So it's almost like the hair follicles are getting downgraded
Exactly.
from producing those strong, thick hairs to producing the wispy ones.
Precisely.
Okay.
And this brings us to another key point.
Okay.
Donor dominance.
Oh, yeah, I've heard of that.
The hair on the back and sides of the head, what we call the occipital region,
Right.
that hair is resistant to DHT. That's why it's the gold standard for hair transplantation.
Ah, so that's why transplanted hair doesn't just fall out after a while.
Exactly.
It's got that built-in resistance.
That's right.
Makes a lot of sense.
Now, the source material also mentions other types of alopecia, like alopecia areata and scarring alopecia. It's a good reminder that we need to think about differential diagnosis.
Okay.
Rule out other conditions before jumping into a hair transplant.
So proper diagnosis is crucial,
Absolutely.
just like with any other procedure.
Exactly.
Now let's talk about the hair transplant procedure itself.
Okay.
The source material mentions indications and contraindications.
Right.
So a good candidate would be someone with androgenetic alopecia,
Yeah.
while someone with active scarring alopecia or an unstable scalp condition might not be suitable.
Right. Stable scalp is key for a successful transplant.
Right.
And when assessing male patients for androgenetic alopecia, you absolutely need to be familiar with the Norwood scale.
Ah, the Norwood scale.
Yeah.
The classic classification system with
Right.
all those stages of hair loss ranging from type I to type 7.
That's it.
It's a lot to remember, honestly.
Yeah, it can be a bit overwhelming.
Is there any easy way to keep those stages straight in my head?
A helpful way to remember it is to think about it as a progression of severity.
Okay.
So minimal hair loss at type I, and then it goes to extensive hair loss at type 7.
Right.
And visualizing those classic patterns can be really helpful for the exam.
Okay.
For example, type 2.
Yeah.
Think about those receding temples.
Okay.
Or type 4 with the classic island of hair on top.
Okay. I can see how that visual association would be helpful.
Right.
I bet there's going to be an exam question about identifying the Norwood stage
Oh, you bet.
based on a clinical scenario.
Definitely.
Okay, so I got to be ready for that one.
Now, when it comes to female pattern baldness, we use the Ludwig scale.
Okay.
This one's a bit more nuanced than the Norwood scale.
Okay. How so?
It takes into account not just the pattern of hair loss,
But also things like hair density, texture, and color.
wow.
It's a lot more to consider.
So it's not just about filling in a bald spot. It's about creating a natural-looking result that complements their individual characteristics.
Exactly.
That's pretty cool.
It is pretty cool.
Now, before we get into the actual surgical techniques,
Okay.
let's touch on some non-surgical treatment options.
Sure. Right.
The source material covers medical therapy,
Right.
which includes medications like minoxidil and finasteride.
Yes, those are the mainstays.
Right. Those medications are more about slowing down hair loss,
Yeah.
not necessarily reversing it completely.
That's right.
They're often used as adjuncts to surgery, not replacements, right?
Precisely.
And then there's laser therapy, which is a newer approach.
Yeah.
And I feel like there's some excitement around it, but also some skepticism.
Yeah, there's definitely some debate about its effectiveness.
We'll unpack that a bit more later on.
Sounds good.
Okay, so let's dive into the surgical therapy aspect.
The source material emphasizes 3 core principles for successful hair transplantation:
Okay.
achieving a natural look, designing a normal hairline, and minimizing scarring.
Those are the big ones.
Seems like pretty sound advice for any aspiring hair transplant surgeon.
Absolutely. Those are the foundations.
Okay, so it all starts with meticulous preoperative care.
Yes.
We're talking about assessing the patient's overall health,
Right.
making sure they've stopped any medications that could increase bleeding risk, like NSAIDs,
Absolutely.
and of course, getting a detailed allergy history.
Can't forget that.
You don't want any surprises in the OR.
No, you do not.
Makes sense. You want to minimize any potential complications.
Exactly.
So once the patient is cleared for surgery, what's next?
Preoperative planning.
Okay.
This is where we get strategic.
Okay.
The source material highlights some important figures.
All right.
The average scalp is about 500 square centimeters.
Oh.
And a healthy scalp has about 1 follicular unit per square millimeter. So we need to consider the patient's age, their existing hair density, and the potential for future hair loss.
Wow. So you're not just moving hair around. You're basically doing advanced math
It's a lot of calculations.
to make sure there's enough donor hair to create a natural result.
Exactly. We want it to look good and last.
That's incredible.
And that brings us to donor site selection.
Okay.
So where we take the hair from depends on several factors, including the patient's age and how much hair loss they have.
Okay.
For younger patients, the donor area is typically higher on the back of the head,
Gotcha.
while for older patients, it's lower down.
So you're taking into account the fact that hair loss can progress over time
Exactly.
and making sure there's enough donor hair to work with in the future.
You want to plan for the long term.
Like a long-term investment strategy for hair.
That's a great way to put it.
I like that.
Now, once we've mapped out the donor area, we need to decide on the types of grafts we'll be using.
And this is where we get into mini grafts and micrografts, right?
That's right. Those tiny bundles of hairs
Yeah.
placed to create that fullness.
Can you explain the difference between the two
Sure.
for those of us who are maybe not as familiar?
Mini grafts contain a few hairs each,
Okay.
while micrografts usually just have 1 or 2. Natural-looking hairline.
Yeah.
And then larger mini grafts to fill in areas of thinning.
So it's almost like painting with hair using different brushstrokes.
Exactly.
That's fascinating.
Now, I know there have been significant advancements in harvesting techniques.
Oh, yeah. Tell me about those, because I definitely want to avoid creating that doll's head look.
Don't worry, those days are long gone.
Oh, good.
Back in the day, we used punch grafts, which were those circular plugs of hair
Right.
that often looked, a bit unnatural.
Yeah.
Thankfully, we've moved on
Okay.
to more refined techniques like strip excision,
Okay.
follicular unit extraction, FUE,
Mm.
and laser harvesting.
Okay. Tell me more about those.
So strip excision involves removing a thin strip of scalp from the donor area, which is then dissected into those tiny grafts we talked about. It's a very efficient technique.
Sounds pretty straightforward. What about FUE?
With FUE, each follicular unit is individually extracted using a tiny punch.
Wow.
It's a more time-consuming process,
Okay.
but it leaves behind tiny dot-like scars that are less noticeable than the linear scar from strip excision.
So less visible scarring,
Right.
but takes longer.
Exactly.
Got it. And what about laser harvesting? That sounds pretty high-tech.
It uses lasers to precisely extract the hair follicles. It offers incredible precision, but it's also a slower and more expensive process.
Okay.
And there's a higher risk of damaging the follicles if not done properly.
So like any tool, it has its pros and cons.
Exactly.
You got to weigh the benefits against the risks.
Right. And speaking of efficiency, the source material highlights the importance of having a skilled assistant.
Oh, yeah.
They can be incredibly helpful
I can imagine.
with harvesting, dissecting the grafts, and keeping the whole procedure running smoothly.
Yeah, makes sense, especially when you're dealing with thousands of tiny hairs.
Exactly.
Every extra pair of hands helps.
Absolutely.
Okay, so we've got our grafts. We've mapped out the donor area. Now comes the crucial part.
Hairline design.
Yes, designing the hairline.
This is the make or break element of a successful hair transplant.
Okay.
We need to understand the natural contours of the scalp,
Hmm.
the angles of hair growth, and the position of key landmarks like the glabella and the lateral canthus.
So we're talking angles, proportions.
Yes,
Basically making sure that new hairline looks natural and harmonious with the rest of the face.
exactly.
Wow.
And it goes beyond just the shape of the hairline.
Okay.
We also need to pay attention to the subtle variations in hair direction that contribute to a natural look.
Gotcha.
The source material even gives specific angles for different parts of the hairline.
Really?
45 to 60 degrees for the frontal hairline. Wow.
75 to 80 degrees posterior to the hairline and so on.
That level of detail is amazing.
It's really both an art and a science.
I never realized how much thought goes into creating a natural-looking hairline.
It's a lot more than people realize.
And density is another crucial factor, right?
Absolutely.
Too sparse, and the hairline will look thin and unnatural.
That's right.
Too dense, and you risk that doll's head appearance.
Exactly. It's all about finding that balance.
I can see how finding that balance is critical.
It is.
Are there any other common pitfalls
Mm.
we should be aware of when designing the hairline?
One common mistake is placing the hairline too low,
Okay.
which can make the forehead look disproportionately small and unnatural.
Okay, so avoid the low hairline. Got it.
Yes, avoid the low hairline.
It's amazing how a seemingly small detail like that can have such a big impact on the result.
It really can.
So we've got to pay attention to those details.
Absolutely.
Now, once those grafts are meticulously placed, we move on to postoperative care.
The source material recommends a non-stick dressing
Right.
and a turban wrap.
Yeah, to protect those delicate grafts.
Makes sense. And what about patient instructions? What should we tell them to do or not do after surgery?
Well, the first few days are critical.
Okay.
We need to make sure they avoid any activity that could dislodge the grafts.
Like?
Strenuous exercise, heavy lifting,
Okay.
or even scratching or picking at the scalp.
Gotcha.
So no touching.
And I'm guessing gentle hair washing techniques are important too.
Absolutely. The pour method is ideal.
The pour method.
Yeah, where you gently pour a mixture of shampoo and water over the scalp
Okay.
and avoid any harsh scrubbing.
So treat those grafts like delicate little seedlings
Exactly.
that need to be nurtured with care.
That's a great analogy.
I love that analogy.
And of course, follow-up appointments are key
Right.
to monitor healing and address any concerns.
So typically, how often are those follow-up?
We typically see patients about a week after surgery and then have subsequent appointments to assess hair growth and make sure everything is progressing as expected.
This has been incredibly helpful.
Good. I'm glad.
But let's face it, even with the best surgeon, complications can happen.
That's true.
What are some of the potential complications we should be aware of?
The source material mentions both intraoperative and postoperative complications.
Okay.
During surgery, we need to be mindful of things like excessive bleeding or lidocaine toxicity.
Right. Always good to have those emergency protocols in place.
Absolutely, just in case.
Just in case.
And postoperatively,
Yeah.
we need to be on the lookout for infections, scarring,
Okay.
or poor hair growth.
And I'm guessing that an unnatural-looking hairline or that dreaded doll's head appearance.
Yeah, those would fall into the category of aesthetic complications.
Right.
These are the things that can really impact a patient's satisfaction with the procedure.
Yeah, for sure.
So we want to do everything we can to minimize those risks and create the most natural-looking results possible.
Okay. So much valuable information packed into this deep dive.
It's a lot to take in.
We've covered so much ground.
Yeah.
From the intricacies of hair follicle anatomy to the surgical techniques and potential complications.
It's a complex field.
But before we move on to the next section,
Okay.
let's take a moment to recap those must-know points.
That's a great idea. Let's solidify that knowledge.
Okay, hit me with them.
All right. So first and foremost, You need to have a rock-solid understanding of hair follicle anatomy and the hair growth cycle.
Okay.
Those are like your
A
non-negotiable.
lot of follicular units.
Right.
Anagen, catagen, telogen.
Yeah,
I'm going to be flashcards for those.
good idea.
Okay, what else?
Next, mastering those classification systems is crucial.
Right.
We're talking Norwood scale for men and the Ludwig scale for women.
Yep.
Knowing these inside and out will help you assess patients accurately and formulate your surgical plan.
Okay, so no more confusing my Norwood type 3 with a type V. I'm picturing those classic patterns in my head, and I'm going to make sure I can identify them in a clinical scenario.
Perfect.
Okay.
And finally, you absolutely need to know those surgical techniques.
Right.
From the graft types to the harvesting methods, understand the nuances, the pros and cons, and the potential complications of each.
Makes sense.
Yeah.
I need to be able to, demonstrate on the exam that I can apply this knowledge,
Right.
not just regurgitate facts.
Exactly. Okay, now before we wrap up this deep dive,
Yeah.
remember we briefly touched on laser therapy for hair loss earlier?
Yes, definitely.
Did you want to explore that a bit further?
Yeah, the source material mentioned low-level laser therapy, or LLLT, and fractional photothermolysis.
Yeah.
Are those legit treatment options, or is it just hype?
Well, laser therapy for hair loss is still a relatively new and evolving field,
Okay.
but there's definitely growing interest and research around it.
Okay, so let's break it down. LLLT uses low-power lasers,
Right.
almost like a gentle stimulation.
Yeah, like a little boost.
And then while fractional photothermolysis uses lasers to create those tiny controlled injuries to the scalp.
You got it.
So it's almost like you're tricking the scalp into thinking it's been injured.
Yeah, in a way.
And that kind of kickstarts this repair process that leads to new hair growth.
Exactly.
Interesting. But is there any evidence to support these claims?
There have been a number of studies on both LLLT and fractional photothermolysis, and some have shown promising results,
Okay.
particularly with LLLT.
Oh, really?
Yeah, for example, some studies have demonstrated increases in hair count and hair thickness in patients with androgenetic alopecia who use LLLT devices.
Okay. So there is some scientific backing for it. That's good to know.
Yeah, it's not just smoke and mirrors.
But I guess it's important to remember that these therapies aren't miracle cures, right?
Exactly. It's crucial to manage patient expectations.
Right.
LLT is often seen as more of a maintenance therapy,
Okay.
not a cure.
Gotcha.
And results can vary depending on the individual and the specific device used.
Right. It's not a one-size-fits-all solution.
Definitely not.
Now, shifting gears a bit, this deep dive has been incredibly informative.
Good.
But I'm also wondering about the ethical considerations involved in hair transplantation.
That's a great point.
As future surgeons, what are some of the things we should be thinking about?
Well, one crucial aspect is patient selection.
Okay.
We need to carefully evaluate each patient and determine if they are truly a good candidate for surgery.
Okay.
Not everyone who desires a hair transplant will benefit from it.
Right.
We need to be realistic about what we can achieve and avoid operating on patients who might have unrealistic expectations or underlying medical conditions that could complicate the procedure.
Right. It's about doing what's in the patient's best interest, not just what they might want.
Exactly. Informed consent is another crucial ethical consideration.
Okay.
We need to make sure our patients fully understand the risks and benefits of the procedure, as well as the potential for complications.
And that means having open and honest conversations with patients.
Absolutely.
Making sure they understand that hair transplantation is a surgical procedure with potential downsides.
Right.
Not just like a guaranteed quick fix.
It's important to be upfront about that.
Yeah, for sure.
It's also important to be aware of the potential for exploitation.
How so?
Well, hair loss can be a sensitive issue for many people.
Right.
And some patients may be vulnerable to aggressive marketing tactics or unrealistic promises.
Yeah, I can see that.
It's our responsibility to provide evidence-based information and guidance,
Okay.
empowering patients to make informed decisions.
That makes perfect sense.
Right.
So we're not just surgeons.
Right.
We're also educators and advocates for our patients,
Exactly.
helping them navigate these complex issues.
That's a great way to put it.
And finally, we need to be mindful of the social and cultural factors
Yes.
that influence perceptions of hair loss and hair restoration.
Absolutely. Those play a big role.
So we need to be sensitive to our patients' diverse experiences and perspectives,
Right.
approaching each case with empathy and understanding.
Precisely now, before we wrap up this section of our deep dive,
Okay.
I want to leave you with a thought-provoking question to ponder.
Get me with it.
Given the ever-evolving nature of hair restoration and the increasing demand for these procedures, What steps can we as a profession take to ensure that ethical considerations remain at the forefront of our practice?
Wow, that's a great question. I'm definitely going to be thinking about that. And listeners, we encourage you to do the same.
Yeah, join the conversation.
This deep dive has shown us that hair transplantation is a multifaceted field.
It really is.
It requires not only technical skill, but also a strong ethical compass.
Absolutely.
Okay, future hair transplant gurus. We've covered a ton of ground in this deep dive into hair transplantation.
We have.
I don't know about you, but I'm feeling much more prepared to tackle those FRCS PLAS exam questions.
Well, I think you're ready.
So let's do one final recap of those must-know points,
All right, let's do it.
starting with hair follicle anatomy and the hair growth cycle.
Of course, those are the foundations.
Yeah, got to know those phases like the back of your hand.
Absolute.
Next, we have those all-important classification systems, the Norwood scale for men and the Ludwig scale for women,
Yeah, those are key.
essential for patient assessment and surgical planning.
Can't forget those.
And of course, we can't forget about the surgical techniques, from graft types to harvesting methods. Make sure you understand the pros and cons of each, as well as the potential complications.
Right, you gotta know your stuff.
And remember, hairline design is where the art meets the science. It's all about creating a natural-looking hairline that complements the patient's facial features and hair characteristics.
That's the goal.
We also talked about potential complications both during and after surgery. Be prepared to discuss those and demonstrate that you know how to manage them.
That's right.
And let's not forget those ethical considerations. Patient selection, informed consent, and avoiding exploitation are all crucial aspects of responsible hair transplantation.
Couldn't agree more.
It's a good reminder that we're not just technicians, we're healthcare professionals with a responsibility to our patients' well-being and satisfaction.
Absolutely.
Now, before we send you back to your studies, let me just say this hair restoration is a constantly evolving field.
It is.
New techniques, new technologies, and new ethical challenges are emerging all the time.
It's an exciting time to be in this field.
So it's up to us to stay curious, to keep learning, and to never stop questioning.
That's the key to success.
Well, that's about it for our deep dive into hair transplantation. I hope you found this helpful, and I wish you all the best on your FRCS PLAS exam.
Good luck, everyone. You got this.
And until next time, keep those scalpels sharp, those minds even sharper, and happy hair transplanting.